Granuloma comprehensive overview. Granuloma are a specific type of chronic inflammatory character by the formation of small localized collection of modified macrophages surrounded by lymphocytes. There are the body's way of isolating and controlling a persistent irritant or pathology that is cannot eliminated. Definition: the granuloma is a focal area of chronic inflammatory composed of macrophage often modified to epithelioid cell surrounded by lymphocyte and sometimes plasma cell. Type of granuloma: immune granulomas caused by persistent microbe or irritant. Example: tuberculosis caused by Mycobacterium tuberculosis. Foreign body granuloma caused by inert foreign material, suture material, talc. These do not elect an immune response. Caseating granulomas, central necrosis present. Example: tuberculosis. Non-caseating granulomas, no necrosis in the center. Example: sarcoid. Crohn's disease cause infection agent bacteria: Mycobacterium tuberculosis, Mycobacterium leprae. Fungi: histoplasma, blastomites, parasite, syncytomyces. Non-infection cause foreign body, tack, sutures, immune-mediated disease. Sarcoids, Crohn's disease, unknown cause, granulomatous with polycystitis. Pathogenesis, persistent stimulus, chronic infection, foreign body, immune response lead to macrophage activation, formation of epithelioid cell. Macrophage transfer into epithelioid cell, which are specialized to secrete cytokines. Gain cell formation, fusion of macrophage create multinucleated gain cell, Langerhans cell, foreign body and gain cell. Lymphocyte requirement, surrounding lymphocyte assisted in containing an immune regulation. Microscopic feature: core modify macrophage, gain cell, peripheral zone, lymphocyte, plasma cell, fibrous capsule develop over time. Necrosis, casing non-cheating. Gross feature: firm nodular lesion. Caseating granulomatous may have a cheesy necrotic appearance. Diagnostic method: histopathology, examination of true biopsy, spatial stain, Gisler-Nistler stain for tuberculosis, pass for fungi. Radiology checks X-ray, CT scan for pulmonary granulomas, blood test ESR, CRP or specific serological mark. Clinical significance: granuloma help isolated pathogenesis or irritant but can cause tissue damage. Persistent granuloma may lead to complications like fibrosis. Example of disease with granulomas: disease granuloma type cause tuberculosis, Chiastic granuloma, Mycobacterium tuberculosis. Sarcoids, non-Chiastic granuloma, leprosy, caseating or non-Chiastic Mycobacterium leprae. Crohn's disease, non-Chiastic granuloma, autoimmune. Syphilis, granulomatous granuloma, lipidema, pallidum. Schistosomiasis, immune granuloma, cystoma species. Treatment: infection cause antimicrobial therapy, antitubercle drug for TB, immune mediated immunosuppressive therapy. Example: corticosteroid for sarcoids. Foreign body surgical removal is necessary. Let me know if you need more detailed information or specific illustration.